So welcome to our first G&T. This is a new platform that we're going to try to do a weekly conversation with some topics. Sometimes they're going to be taboo topics, and sometimes they'll be straightforward topics. We're going to have guests coming to these quick snip conversations. But today, since our first one, I think it would be a good idea for us to introduce ourselves and tell about why we got into medicine and why we got into bariatrics. G&T, just a playful way with the words. Ghanem, Dr. Ghanem and Dr. Teixeira, or G and tonic, because it's both of one of our favorite drinks when we are relaxing. Well, let's go ahead and start. So, Ghanem, tell me about yourself a little bit. Our story has been very interesting, how we got together in terms of practice and so forth, which we can talk about later. But we want to know about yourself and why you got into medicine and why bariatrics.
All right. So I am Mohammed Ghanem. I am one of the bariatric surgeons, and I've joined Dr. Teixeira also in the practice for about a year and a half now, actually. And time flies. Can you believe it? It's been almost a year and a half.
I know, right?
Right. And
very painful.
For you, maybe. And basically, I am from Jerusalem. It's where I grew up. And I went to medical school in Jordan, and then I ended up coming to the United States, initially to Mount Sinai, New York for a year. And then I did a fellowship basically at Orlando Health as well in bariatric surgery. And that's where that was the very fortunate day that I got to meet Dr. T finally. And afterwards, I did more residency in general surgery at Methodist Dallas Medical Center. And then I wanted to join this practice because it was one of the better years that I've had. And being a bariatric surgeon, I got to see really firsthand that it was a truly comprehensive bariatric center. That was what I was, in my head, at least what I wanted to pursue as a career. And it really ended up being every bit of what I imagined. And as a result, I always aspired to come back. And here I am. And now I unfortunately share the office with Dr. Teixeira, of course, who tends to be very messy, and I'm a very tidy person. So once you look at the desk, you can immediately tell who is the one who's Dr. Ghanem's office and which one is Dr. T's office. Right.
So this is interesting, right? So you basically did 2 general surgery residency, one in Israel and one here.
Right.
So we don't see that very often, which is kind of awesome because you have a outstanding and a very large experience in general surgery, also in bariatric, because that's what you're doing also in Jerusalem. And it brings a whole different perspective to the treatment of bariatrics, right? Obesity for them, or metabolic diseases.
Right, and I think it gave me a lot of advantage. I can say to my patients, and they sometimes ask, and I can tell them with quite a bit of confidence that they can be relaxed that I'm quite a bit overtrained. Training, I definitely do not lack, and I've done twice as much more training than most people do. And I think the big advantage of it, honestly, was that you get to see how things are done in different institutions by different people, and that opens your horizons a bit, and that makes you. Once you tackle a different case or a difficult case, you can say, okay, I've learned this from that person back in Jerusalem or back in Dallas or here really. And it opens your horizons rather than just being in one institution.
Right. Tell me a little bit about, in terms of, your day-to-day, like, what you like to do for fun, relaxing, besides recently engaged.
Yes, recently engaged I am. So I really wake up at 5 a.m. pretty much every day. And that doesn't matter of whether it's the weekends, unfortunately, because I lost the ability to sleep in. And it doesn't matter whether this is also an operative day or not. I wake up at 5 a.m. and it's going to depend on my days. My clinic days, after I have my morning coffee, I either go for a run or I go do some CrossFit in the morning. And that kind of gets my day going. That wakes me up. and that clears my mind. And once I do so, and then I head to the office and I start seeing patients usually by 8:30 or so. On operative days, it's really the exact same thing minus the run, except I just come here a bit earlier and I start operating. What I do for fun is really mostly running and exercising. I like that, and it's kind of my way. I'm not really super fit, but it helps me clear up my mind and help me focus, I guess, in a way, or take out the bad energies or the stress of the work or stress of every day-to-day life. And I tend to read quite a bit of books that are not medical. That is
Yeah,
one
that's what I was
thing
going
that
to
I
say.
do.
Is one thing interesting about you is that you read a lot, or audiobooks, like you told me, which is also a nice way
Right.
to do it too.
Right.
Which is it kind of makes we get so focused in what we do, and we are so immersed into patient care, what's going on, the new things, and how can we make it better. Always trying to fine tune, even if it is a little thing which we have to have data and so forth. So sometimes it's a little more tricky, but which has always been nice to have someone around that read a lot different other things. It's awesome. And congratulations on your new engagement. Hopefully I'll get invited for your wedding.
Thank you. Once COVID is done and we figure out truly what we can do, we'll definitely invite you. So tell us about you. Where you come from, which I have a lot to say about.
Yeah. So my story is a little bit different. I was born here in Atlanta, Georgia. Both of my parents are physicians, so they were trained here, but they wanted to go back home, which home is Brazil. So I was raised in Brazil.
Where in Brazil?
At the age of 3.5, I moved to Brazil.
Where in Brazil?
Northeast, which is a coast city called Recife. It's
right. Which for those of you who don't know is the shark attack capital of the world. Just an interesting piece of information.
Well, yeah, sure.
It is.
You just have to learn how to swim with them.
Yeah, sure.
So, and then, for whatever reason, since I remember, I always wanted to be a physician. I just thought it was such a cool field to work at and helping people. Anyway, that's what I wanted to do. And my initial goal was to do medical school back at home and come here and do residency and so forth. But then I just decided to do everything here. So in 96, I moved here to Georgia. I went to undergrad, medical school in Georgia. And then I did my residency here, actually, at Orlando Health. And then I did my fellowship at Cleveland Clinic. And then I was fortunate enough to come back here and join our CU partner, which is Dr. Jawad. And that has been almost 11 years now. And, it's funny because when I applied to fellowship, I applied to do MIS, or minimally invasive surgery, because I really wanted to do esophageal surgeries and more what we call foregut surgery, which is different type of surgeries. And the program that I went, we did a lot of bariatrics, but within the first month, I fell in love with bariatrics. There is no field of surgery that you can help someone give their life back, right? And they can live their life again, enjoy their kids, grandkids, family, spouse. And that's priceless, So I've been very happy, been pretty happy with my career so far.
Do you think your choice of wanting to be a doctor? Sorry, I think you could offer a bit. Do you think that your choice of wanting to be a doctor was influenced by your parents by any way?
No, I do come from a family that has a lot of physicians.
Okay.
But interesting enough, when I told my parents I wanted to come here to do medicine, my dad and my mom was like, "Are you sure you want to do this? Because this is a lifetime commitment that sometimes you have to put your family as in second place." But I'm very fortunate. I have a very wonderful family. My wife is super understanding that sometimes I have to go to the hospital, work late hours and so forth. And she understands that. But they've been supportive of that. But it was never, you have to be a physician, you have to do, you know what I'm saying? As the only thing that both my parents told me is that whatever you decide to do in life, make sure you're the best at it. And that's the same thing I tell my son, right? I don't care what he wants to be as long as he's successful, right? That's where you become happy, right? But other than that, as you know, I'm a pretty workaholic.
You are.
A workaholic.
Yes, you are.
Yeah, I know, right? So I'm involved in so many different directions, so many different things. And it has been very nice, actually, to have you around in the past year and a half, because it has shown me we need to live our life to enjoy, take vacations, so forth. I have never taken vacation from August to January ever in the last 11 years. This is the first time I did in September, in Thanksgiving. I took a week off and I traveled with my family. It was the best thing I've done.
Right. And it's good. It's good for you. Yeah. It's good for your family, and it's good for your patients, I want to say, even, right?
Correct. So a good work-life balance is very important.
It is. Right.
And I'm learning, there's never too late to learn.
Right. And I will say that, honestly, since I came here, you did learn and you did change that. And I was impressed by that change.
Yeah,
given it that how old you are and how hard for old people to change.
I'm a young guy, man. I might have the gray.
Sure. Look at that beard.
That's the stress working with you. That's the problem.
That's how I lost my hair too.
Exactly. So, it's been a good journey. I love to travel. Every year we try to do a couple international trips with my son. We like to expose him to different cultures. We go home. We try to go home once a year to see our parents, and my son got exposed to the family there. We're pretty family oriented. We do a lot of things together all the time, the three of us. So I've recently got into bicycling, so into Peloton. So I got a Peloton. I'm doing that. So I'm do some things different, exploring, and I'm enjoying it.
Good. So you're part of the Peloton cult now, basically.
Well, I don't know. I'm a part. Listen, if my wife says she wants it, we do it, and then we do it. So
then they should start sponsoring our podcast, I guess.
Yeah, sure. So so one thing I wanted to talk to you too is that this is the busiest time of the month for any surgeon, right? Because of insurance, patients want to have their surgeries now. And both of us have a pretty busy schedule. What do you think about that? I mean, should we try to help as many patients as we want, or should we put a limit and what we do just so we can continue our work-life balance, right? That's the tricky part, that sometimes we wanted to help as many people as we want.
Right. And I think that is always, you want to have that work-life balance, but there's always that something in you that wants you to push and help more and do more. I think it is very reasonable to say, okay, in this last month of December, this is where people really need us the most, and this is going to be the busy month for me, and that's okay. I talked to my fiance beforehand, and I told her, okay, this month you're going to have to excuse me, and she's going to be completely on board and basically understanding to that. And I'm pretty sure the same thing with your family, wife and son.
Yeah. Yes. Well, she's used to.
Right. But I think it's important to not lose track and eventually, have that month and a half or whatever month that we have that are fairly busy, end of November, let's say December till the start of the new year, to continue on, and that become the new norm. And I think it's important to not get sucked into that. And what you really touched on beforehand, because one thing that we talked about is that I got exposed to different hospitals, even completely different work systems with completely also different generations of surgeons. I got to see the older, generation that were very old school. I got to see the middle generation. I got to see the newer generation. And it's something that I also, as a personality, tend to do is, for my personality, too much of a good thing is barely good enough. And so if you love surgery, you want to get into it, but it's important to catch yourself early on and make that balance. But I think it's very reasonable to say, bottom line, hey, December is a busy month for us, maybe, okay, end of November till January, month and a half that we know is going to be busy, that we know we're going to try to do our best, but not get sucked into it.
Yeah. On the flip side, too, this is a month that we, the end of the year, right? Thanksgiving,
Right.
Christmas, New Year. So it's always a more difficult month for our patients.
Right.
In terms of temptations and what they're eating and so forth. It's very important that we have everything available to them as they need it, so to keep them on track and so forth. So that's why we keep our office running. We have office on Christmas Eve, operating, you operating also. I mean, we're having everything open, nutrition, psychological assistant, always open to the patients. And I think that's a very important part of our practice, right? To be able to offer this to our patients. Because, I mean, it's difficult, right? Because we're trying to help the patient, we just try to give them a tool, quote unquote, that's going to help them to achieve the goal that they have, right? But that too, you have to have some TLC, right? Otherwise, it's not going to last forever. With that said, there's always that question that we get at this time of the year is that, Dr. T or Dr. Ghanem, can I have a drink? Can I have a glass of champagne, right? Is it okay? And I think I'm not opposed for them to have that. We just have to be where they are on their journey, right? If they just had their surgery, I would say I wouldn't do it because your body's already in overdrive, trying to adjust itself. Your liver is trying to adjust itself in terms of metabolic states. And you don't want to add another insult to it, or sometimes fall off the wagon a little bit, right? But if you've been out from surgery for a long time, I don't think there's nothing wrong, and you have established new behaviors, there's nothing wrong with that.
What you're saying, it's okay to have a little fun.
Yes.
It's okay as long as you recognize that, hey, first of all, this is what you stated. You're not 2 weeks after surgery. You're not 1 week after surgery when it's fairly early on. But also, it's also important to remember that not to fall off the wagon and develop completely spiral off. Because we all know that once you indulge, it is very easy to gain 10 pounds, and it's much harder to lose those 10 pounds.
Oh, 100%, 100%. So I think it's good that we are able to coach our patients on that matter. Of course, they do have to watch the bubblies, right? Beer, champagne, cider, sparkling, whatever, because that can expand your pouch or your sleeve for that matter.
So what do you tell them to completely avoid altogether, and what do you tell them, hey, you can, if you want to have over a special occasion, you can have some, but what do you tell them, I want you to just
so I never say you should never have this, because if I do that, then they really want to have it. So what I try to tell our patients, if they're 6 months post-op, right, and if they want to try something, I'm okay with it, as long as they don't go beyond, right? If less than that, I tell them just take it easy. You're still trying to figure out things. That's usually what I do.
Right. What about sugars? Because one thing that I noticed, and this is not that I noticed, it's actually been science proven, that processed sugars and high sugar content can be actually addictive. And it does really, the studies that they've done on mice, they show that the same part of your brain lights up when you take, say, candy that is very high in processed sugars, as the same thing as when they take cocaine. for the mice. And so it becomes this addictive habit. That kind of makes me weary of telling them, okay, you can have it, when I know that it can be quite
100%. But
right.
if you have a patient that have been successful
Right.
for a while now, and they completely have changed their habits, I'm okay with it, right? Because, depending on which operation you have, if you try to eat much sugar, you're going to get sick, as you know.
Right.
So I'm okay with it. It's just a matter of having control and understand where you are in your journey.
Mm-hmm. Tell me more about how was your day today? I know you had a busy operative day today.
Yeah, today was a very busy operative day. And I also had some interesting endoscopy cases done.
Right.
But it was a good day. Every time I'm in the OR, it's a good day. I did one revision, which is a conversion of one operation to another for a patient that had a weight regain in the past. Then I had a gastric bypass for a patient that had severe reflux, heartburn, and with a high BMI, and diabetic. And then I had 2 sleeves done. So we had a gamut of pretty much a lot of different things. And my revision was a conversion of a sleeve to duodenal switch, which is a large operation that we do. Everything was done robotically in our team, as you know. In between, I had a endoscopic case that was sent to us to treat. As you know, we're a reference center for complications, so we tend to treat most of the complications in Central Florida. So, but patients doing well, which is good. So it was a very nice day that kept me busy, but with different things.
Right, and for those of you who don't know, that Dr. Teixeira really, his endoscopic skills are very much really unparalleled. He does we do a lot of advanced endoscopy that I want to say most surgeons or bariatric surgeons don't necessarily feel confident with, but what really you do. What got you into that passion? Because I would say that you really have a passion that is more than most surgeons for endoscopic procedure.
That's a good question. So, I think I've always been curious and about the things that we can accomplish through your mouth, right, or to the colonoscopy for that matter. But to me, I do everything to the mouth. I think the normal evolution, right, in my mind, it might not happen in my lifetime, is that we are going to be moving to a true, right, surgeries that will be done through your mouth, right? There are some procedures that can be done now. There are things that be done that if you look at, for example, we went from open surgery, laparoscopic surgery, now in robotic platform, right? And then also there's leaps and bounds of development of robotic platform for endoscopy, right? The same thing, platform for bronchoscopy, which has changed some management of treatment of lung cancer for that matter, right? So same thing for us. So I always wanted to explore that, and I think that the risks that we can, if I can fix a patient with a problem through their mouth, avoid them an operation, the risk is much less than trying to fix surgically. So I always try to do this kind of stuff. If it is feasible, I'll try to give that a shot to see if we can fix it. And I think it's phenomenal.
Yeah, perfect. Yeah, good. And I really got into this really from you once I was here as a fellow, and I saw all of what can be accomplished endoscopically, and basically tried to learn from that. And it is amazing what things can be done, especially if you see that a patient has this specific issue after surgery, like the patient that was transferred to us, what you mentioned beforehand, and they say, okay, I can fix it endoscopically. This can save a huge operation in the future.
Correct. So I think it's the normal progression. But like I said,
Right.
it might not happen in my lifetime, but at least I'm trying.
I think it will. Yeah, maybe not in your lifetime because you're old, but but I think it will eventually happen.
You're so gentle. You need a gin tonic.
I need a gin and tonic, that's for sure.
Yeah, for sure, for sure.